go through these questions. Yes. How long ago did the symptoms begin? This is the first question. Okay, how long ago did the symptoms begin? So that means he's asking for the time. How long ago did the patient's symptoms begin? This is the question. So analyze this question very carefully. How long ago? So if you take this question, so question number 8. How long ago did the symptoms begin? This is the question. Now, if you analyze this question, we have two things. The question word is how long ago. Did the symptoms begin? So, from the beginning, yeah. How much time lapsed? How long ago did the symptoms begin? How long ago? When did it start? When? How long ago did the symptoms start? Means it is when. Okay. It is when. When did the symptoms begin? When? When? So it's not exactly when, but how long ago. This question may be otherwise called as when did the symptoms begin? This starting time. This is period of time. There are two different things. When did the symptoms begin? When is the word. If you take the word when, you can understand it very clearly that there are two things normally. There are two things. How long ago means period of time. This is point of time. This is period of time. He's asking here the period of time. How much time elapsed? This is regarding period of time. But when you say when, you say at what time? When means point of time. Point of time. So these two things you have to understand. How long ago means period of time. When means point of time. So he's not asking point of time, he's asking period of time. You should remember. He's asking period of time. He's not asking when it started. Okay. So period, how long elapsed? 2 years ago, 3 years ago, 4 years ago. So there are three different things here. There are two different things here. One is, you can say, so 2 hours ago. So you can talk about 10 minutes. 10 minutes ago. Okay. You can talk like that one. Or you can say 2 days ago, 5 days ago. How long ago? 5 days ago. So 5 days ago. Or 3 weeks ago. Or 2 months ago. Or 1 year ago. So like this. So you will have the number and you will have the unit. So you have two things, the number and the unit. Two things are very much required here. So what are the two units? Let us see here. So number and the unit. What unit is it talking? There are two different things, the number and the unit. These are the two things that are very much important here. The number and the unit. So focus on these things and you will get the idea, clear picture. The number and the unit. So that's the point here in question. So if you focus on these things, it will be easy for you. Right. So this is the first question. Question number 8. Question number 8. Right. Then next. We're moving to the next question. Question number 9. Question number 9 says, what was the patient doing differently as a result of the symptoms? What was the patient doing differently as a result of the symptoms? What was the patient doing differently? What was the patient doing differently as a result of the symptoms? Yeah, this is the next question. This is the next question. So what was the patient doing differently as a result of the symptoms? So earlier he was doing something, now he is doing something. So what is the difference? What was the patient doing differently? What is that? Some action, doing differently. So this is action. What doing differently? Is it eating, or is it sleeping, or is it walking? Earlier walking normally, but now he's walking with a walking stick. Earlier he was using a walking frame, but now he is using a walking stick or something like that. What was the patient doing differently? So what activity? What is the name of the activity? Name of the activity. Has changed his style. Yes, changed his style. So activity, name of the activity which is doing differently. Name of the activity, name of the action, name of the action. So maybe eating, maybe singing or sleeping. Okay, what was the patient doing differently? So name of the action. So modification. So lifestyle modification maybe. So name of the action. The action may be doing differently, doing. So this is what it's doing. This is the most important word. This is the most important word you can understand. This you have to focus. What was the patient doing differently? Doing is more important. Doing means it may be coming to examples. Let us take the examples. Is it related to sleeping? Or then next one is eating habits. Okay, earlier he is eating non-vegetarian, now he is eating vegetarian. Or is it drinking habits? Earlier he was consuming lot of liquor, but now he is not consuming. Is that drinking, or is that working style? What exactly is he talking about? So, or is it related to sleeping habits? Sleeping to one side, okay? What exactly it is? What exactly is it going on there? So sleeping differently, or eating differently, or drinking differently, or working differently, or sleeping differently, or so what exactly it is? So that you have to identify. This is the most important point. What is he doing differently? You have to identify that. What is the name of that action that he is doing differently? If you focus on this area, then you can definitely understand. You can definitely understand here. Yeah, that is ninth question. Then we are going to the next question. Question number 10. Question number 10. In addition to being tired, yeah, what other symptoms did the patient have? So here, this is another question. In addition to being tired, what other symptoms? What are the other symptoms? Names of the other symptoms. So there may be many symptoms. Did the patient have? Past tense. Did the patient have? Past tense. What? What means the name? Names of the other symptoms. Names of the other symptoms. One symptom is being tired. That means tiredness. Being tired is one symptom. What other symptoms did the patient have? Okay. That's what you have to focus in. What are the other symptoms? So you can just give the names of names of the other symptoms. Whenever he says what, you have to think names of the other symptoms. Names of the other symptoms. You have to focus on that. So focus on these names of the other symptoms. The other symptoms may be, yeah, names of the other symptoms, right? What exactly are the other names? You can say tiredness, anxiety, being anxious or anxiety, maybe anxiety, maybe tension, maybe worry, or some other symptoms. What are the other symptoms? Possible symptoms you have to guess. Anxiety, tension, worry, then sleeplessness maybe. Sleeplessness may be another symptom, or lack of interest, whatever. So these may be some symptoms. You can think about more possible symptoms. Yeah. So names of the symptoms. You have to think about these names of the symptoms. That's how things go there. Then next, yeah, names of the other symptoms. Right. And the fourth question. Fourth question. That is question number 11. Question number 11. What did Dr. Lopez blood tests show? Symptoms revealed something. What did Dr. Lopez blood show? So whenever you say what, the name of something will be there. Whenever you say what, the name of something will be there. So that is very important. What did Dr. Lopez blood test show? Show means revealed. What? Revealed what? The name of something. The name of something. So diagnosis. Doppler's blood test showed something, revealed something. What is it? That high blood pressure or low blood pressure or something like that. Okay. So what? What means name of something? The name. What did Dr. It may be singular or plural. Name of something. Something was revealed. What was revealed there? You have to notice. What was revealed there? You have to notice. What did that reveal? Blood test reveal what? Blood test reveal what? Reveal maybe, yeah. So you can give some examples there. What did Dr. Lopez blood test reveal? Yeah. Sugar levels maybe. Sugar levels or insulin levels, whatever you call, or what else can be shown there? The blood test, low RBC, okay, count. Yes, come on, you can write whatever you feel. You can write there. Anemia, high cholesterol level, yeah, okay. Cholesterol revealed something like, yeah. Yeah, it may be blood sugar levels, blood sugar, high blood sugar or something like that, or cholesterol, or anemia. So whatever, you can imagine all the things possible. So these may be revealed, and there are many more which can be revealed. You have to guess all those things. These are the things that may be showed. So what are showed here? What did the blood test reveal? So you have to think like that. When you think like that one, you get the options, various options. So that is very, very essential. Okay. Function print screen. Now coming to the point. We'll take all the four things here together now. High bilirubin levels. Yeah, very good. So this is how you will think about. And now let us take these four questions in one. So all in one. All in one. Four questions. Question 8 to 11. 8 to 11. Okay. Questions 8 to 11. So question number 8. This is question number 8. Question number 8. And this is question number 11. Okay. And we have question number 9. What is that? One second. Yes, coming. So, 8, 9, 10, 11. Eight, 9, 10, 11. Yes, so there are four questions here. This is 8. This is 9. And this is 10. Yes, so there are four questions here. Right. Start this now. So four questions. Let us take 8 to 11. So 4 questions will think about these things like, okay, 1 to 4, let us consider that. Yeah, all the 4 questions are here. Okay, 1 to 4. Okay, so let us take these 4 questions. Yeah, let us take these 4 questions. Now we are going to do some brainstorming. We are going to do some brainstorming. So question number 1. Question number 1. So what do you think answer you can write there? Guess. Guess what may be the answers? Guess. Brainstorming. Guess your answers. Guess your answers here. One to 4 questions. And Kaplan track number 1. We know it is track number 1. So I'm going to give you track number 1 now. Kaplan audio. Kaplan audio files. This is track number 1. Yeah. Okay. Now, yeah, give the answers. Yeah, 1 week ago, 1 month, last week, a year ago. 4 week is wrong, Anushka. 4 weeks may be right. 4 weeks. Think about the other options, please. Think about the other options also. Think about the other options also. Yeah. Only one don't give. Give 3 or 4 options. Now keep your mind fresh. Then we'll go for question number 2. Question 2. Question number 2. Question number 2. Yeah, think about the answer. What was the patient doing differently as a result of the symptoms? Give your answers. Guess, guess. Guessing is very important here. Yeah, walking, sleeping, start swimming exercises. Yes. Yeah. Next, we'll go to question number 3. Now, question number 3. Question number 3. Guess the answers. Yeah, dizziness, nausea, fever, weakness. And next, question number 4. Question number 4. Yes, what did Dr. Lopez blood test show? Yeah, very good. Now I am going to play this audio and we are going to the session. Very good. So I'm going to play the audio. Don't write anything. Take your notebook and write 1, 2, 3, 4. Write your notebook 1, 2, 3, 4. So we are playing the audio now. So this is track number 1. Track number 1.
Could you tell me, in your own words, what's brought you here today?
Yes, of course. Well, I went to see my general doctor, Dr. Lopez, because I've been feeling really tired. It had been going on for about 2 months, though I hadn't been to him sooner because I wasn't sure it was serious enough to warrant a visit to the doctors. I'm generally the sort of person that just gets on with things, you know. I tend to let my body heal itself. But it got to the point where I was going straight to bed when I got home from my job and not waking up until the morning. And I'd still be tired the next day despite all that sleep. I also found that I was gaining weight, eating the same amount of food I've always had, maybe even less. I became a bit of a zombie, really. I had trouble focusing at work and paying attention to what people were saying. It was my wife that eventually got me to go and see the doctor about it. She said I looked like I was on autopilot. Anyway, when I saw Dr. Lopez, he gave me lots of blood tests to see if I was lacking in anything. Most everything turned out fine, but the blood test showed that I think it was my thyroxine levels were on the low side, so Dr. Lopez referred me to you.
So we have got to that one now. So I will be playing once again for you. Check your answers and confirm whether they are right or not. Then afterwards I'll tell you the answers. Yeah. Don't write anything in the chat box.
Could you tell me, in your own words, what's brought you here today?
Yes, of course. Well, I went to see my general doctor, Dr. Lopez, because I've been feeling really tired. It had been going on for about 2 months, though I hadn't been to him sooner because I wasn't sure it was serious enough to warrant a visit to the doctors. I'm generally the sort of person that just gets on with things, you know. I tend to let my body heal itself. But it got to the point where I was going straight to bed when I got home from my job and not waking up until the morning. And I'd still be tired the next day despite all that sleep. I also found that I was gaining weight, eating the same amount of food I've always had, maybe even less. I became a bit of a zombie, really. I had trouble focusing at work and paying attention to what people were saying. It was my wife that eventually got me to go and see the doctor about it. She said I looked like I was on autopilot. Anyway, when I saw Dr. Lopez, he gave me lots of blood tests to see if I was lacking in anything. Most everything turned out fine, but the blood test showed that I think it was my thyroxine levels were on the low side, so Dr. Lopez referred me to you.
Right. So that is how you are going to write the answers. Now I'm going to give you the options of writing the answers. Okay, now what you heard based on that one. Question number 1. So 7, I'll tell you, then only you have to submit. Until then, you should not submit. So I'll count from 10. Write and keep it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and submit. Asha Jama, 2 month. Okay. Ranita, 2 months. Where is the separation? Line and gap. Okay. Aisha's answer. If it is 2 months, then your answer will be wrong, Aisha. And Pranita, your answer also will be wrong because 2 and months between there is no space. Okay. Your answer will be wrong. Check in your notebook how you have written. If you have written in the notes correctly, then okay. Next question number 2. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and submit. Anushka Gupta, waking up. Waking up or waking up? Is this what you have written in the notebook? Then this is wrong. Okay. Next is question number 3. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, submit. These are questions. So question capital letter you can put in the beginning, no problem. With or without, it's okay. Because these are short answers. Next. Question number 4. Okay, don't send me direct message, anybody, please. And I have to change it again to everyone. Yeah, question number 4. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and submit. Okay, now let us check our answers. Now let us check our answers. 42. I'm going to show you the answers. Yeah. Answers. Question number 1. Yeah, question number 1. This question number 8 onwards. That is 2 months. The answer is 2 months. That's right. The answer is 2 months. Yes, number 9. Question number 9 is going straight to bed. Going straight to bed. Going straight to bed is the right answer. Then question number 10, gaining weight and trouble focusing and paying attention. 3 things. Number 1 is gaining weight. Number 2 is trouble focusing. And 3 is paying attention. 3 things are there. Gaining weight, trouble focusing, and paying attention. 3 things, not 1 thing, 3 things. Okay? Right. Then next one. Thyroxine was low. Thyroxine level, low side. Thyroxine level was low. Thyroxine was low. Okay, based on this, okay, thyroxine level on the lower side or low. Thyroxine level, thyroxine was low. Now you based on these things, score. What do you think your score is out of 4? Score out of 4. Give your scores. 7, 6, 5, 4, 3, 2, 1. Submit. Yeah, this is how listening you have to practice on a daily basis. Listening on a daily basis you have to practice. Now, let us see. Maranang Makoko. Hello, Maranang. Can you unmute?
Yes, sir.
Yeah, share your experience. How did you feel regarding when you are doing?
It was a bit tricky, this listening, but all is well.
So preparation before brainstorming and all, was that useful or not?
It was very useful, sir.
Okay. Next, Aisha Jama. Aisha Jama. Aisha Jama.
Yes, sir, I'm with you.
Yeah, Aisha, how was the session? What did you feel regarding this practice? We learned some 4 questions.
It's helped me to focus more. Like there is some tricky things that we have to focus. For example, here it's written like thyroxine was low. I wrote that thyroxine level in low.
Thyroxine level was low. Okay. Thyroxine was low. Thyroxine was on the lower side. Okay, fine. That's fine. Yeah. And so imagining or guessing and thinking about the answers, did it help you in any way?
Of course, it's like if it's tricky, we have to concentrate and know the answer, the perfect answer to write.
Yeah, very good, very good. Anushka Gupta. Anushka Gupta.
Oh, yes, sir. It is helpful, and yeah, the concentration is only the tricky. Instead of writing the going straight to the bed, I have written the waking up. So that I learned, sir, today.
Right. Pranita Pamarti. Pranita Pamarti. Hello, Pranita.
Sir. Hi, sir.
Yeah. Yeah. Tell me, how was the? Oh, you are busy little, I think. Okay, no problem. Share your experience. How was that helpful to you?
Yeah, it's practice is more, sir. I'm not having practice now. That's what I'm very low. I will
Okay,
practice.
fine. Yeah,
Thank you
yeah,
so much.
fine. Okay. Now we have seen this listening, and then we'll go to reading now. Okay, we'll go to reading. We will join on the same link after exactly 5 minutes. We'll join on the same link exactly after